everybody enjoyed their lunch. I definitely did. Of course, after we've enjoyed our lechong pupa, the first time ko na try, and all of the other food today, we're here to see a demonstration of how the Wireless Access for Health program actually works. So ito po, we're here to show you how the system works in real life. So if you please, we would like to call your attention to the group on stage, and we'd also like to call on Dr. Jeanette Lazatin, who will walk us through the process step by step. Let's give her a round of applause, please. Dr. Lazatin.
Magandang hapon po sa ating lahat. Welcome to the Wireless Access for Health Community Health Information Tracking System EMR demo. Today, the Wireless Access for Health system is installed in the 4 pilot sites in Herona, Moncada, Paniqui, and Victoria with more than 12,000 patient consultations. Today, we want to show you how we use the Wireless Access for Health CHITS-EMR and how it has improved the operation of our health centers. An RHU typically has 3 stations, one at every major point of patient care. We have the admission, consultation, and treatment. But for the demonstration, we will simplify and just use 2 stations. You can refer to the white screens to follow each step of the process as our RH personnel use the system. This is the admission station. This is where the patient is first received by our midwives. The electronic system allows us to find and access the patient's record in seconds. This is a process that used to take more than 5 minutes for every patient when the RHUs had paper records. This is also where we record a patient's current vital signs and chief complaints. So right now, the midwife is checking the vital signs and the chief complaint and the history. So we could see that the blood pressure of the patient is 100/80, body temperature is 36, and then we go to the chief complaint. So patient is having cough and colds for today. So cough, colds. As soon as the chief complaints are recorded, the patient data is available for viewing at the doctor's unit. The patient will then proceed to the consultation room where the doctor is. This second station is the consultation area. This is the place where the doctor sees the patient. When the patient comes in, the doctor is able to see the information that the admission staff has entered. For this case, our patient's chief complaint is cough and colds. The doctor will then perform a physical examination. The final step is to determine the diagnosis and treatment plan. The MHO records all of this in the system and prescribes any required medication. The last step in consultation is determining the doctor's appointment. So, I will refer you to the screen in front. We could see the chief complaint of cough and colds over the right side, please. And the history, the physical examination, the diagnosis, and the plan. The last step in consultation is determining the next doctor's appointment of the patient, which is also recorded in the system and can be used to follow up when the patient missed their appointment. So for this demo, the next appointment is so you can now see the treatment, safe plan, So the next appointment, according to the doctor, is on June 24. So the schedule is now the same. So that's the end of the consultation demo. We'll now show you how easy and fast it is for us to generate and submit the PhilHealth Services Information System records. These are required by the Department of Health and are critical for planning and policy decisions. Before the Wireless Access for Health program, one of the more difficult tasks the RHUs was preparing these reports. The RHUs used to manually complete the forms. The source data used to come from the lab books and would require hours and hours of manual counting. Once this process is completed, a health clinic staff member would ride a jeepney or tricycle into town and deliver this report to the Provincial Health Office. But with the electronic system, pilot RHUs can generate the reports directly from the electronic patient records and then submit them to the Provincial Health Office in just seconds. This is a big improvement over the jeepney approach. The system can also generate all 23 reports that are required for Tarlac's rural health units. In addition to the FHSIS reports, the system can also generate detailed patient-level reports and statistics. Here on the screen is an FHSIS report that we can now generate using the system. This is the quarterly morbidity report. You can see on the screen a sample of this report. In order to submit this to the Department of Health, we use Qualcomm's 3G technology to transmit the report over Smart Communications wireless network. It takes just a click of the button. The Provincial Health Office and the Department of Health will receive this report instantly, which can guide policies and enable timely resource and public health decision-making. Furthermore, the report is submitted in a format that is readily integrated into the FHSIS system that the PHO uses to collect data from all of the provinces' rural health units. That is the end of our demonstration. We hope that you have seen the positive impact of the system, whether you're a patient, a health worker, or a public health official. The electronic medical system is a powerful tool that can help you and your community stay healthy and happy. Ako po si Dr. Janet Nasadin. Maraming salamat po sa inyong lahat.
Thank you very much, Dr. Nasadin. Of course, our doctors and health workers from our local health unit. Maraming salamat. Mga kaibigan, napakagaling naman na nagsisimula ito dito sa Tarlac, and we're hoping that even more provinces, cities and municipalities will be able to adopt this program. Wireless Access for Health. Alright, at this point, the Wireless Access for Health program and its partners, the province of Tarlac, the municipality of Moncada, and all of the other partners here, would like to express its gratitude to everyone for gracing the occasion and making this event a definite success. Of course, we would like to thank our talents for today, the Moncada Catholic School Choir, the Berhen Milagrosa Drum and Bugle Group, the Moncada Sapang High School Street Dancers, and the Lakota Moncademia Folk Dancers. We invite everyone to visit their local health unit, where you can see how the system works in real life. We also have vans up front to shuttle you if ever you want to visit a local health unit. And